everybody. I wanted to take a little bit of time to talk to you about writing treatment goals. You've had some things in your reading about writing SMART goals, which SMART is an acronym for specific, measurable, attainable, realistic, and time-bound. And so you want to think about goals for your client that align with his or her diagnosis. In the case of Jeff, that a lot of you are working on, Jeff has alcohol use disorder, and, is presenting to treatment around his increased drinking, and concerns that have arisen between him and his wife around that. So those are what you're trying to think about in relation to that. But I wanted to show you an example of a treatment plan. This is actually the template that I use in my private practice. This is a fictitious client, but I wanted to just kind of show you what this looks like. You don't have to do it this way. There is not one right way to do a treatment plan. There are certainly, I think, best practices with treatment planning. And I'll talk about some of those as I talk about the specific plan. But here I have is the presenting concern, feeling depressed after breakup with his girlfriend of 3 years. And I like to use the client's words whenever possible. So you'll see for the overall treatment goal, to feel less depressed enough that I can go out and enjoy doing the things I used to like to do. Okay, so I have that in quotes because it's the client's exact words. So then you'll see here the treatment goal that I came up with, all right? And this is a SMART goal, okay? Because it is, let's revisit that. Oops, it is, all right, specific, okay? It's real, there's a real deadline for it. You'll see what the deadline is. Measurable, all right, and we'll see how it's measurable. Attainable, it's something that is not overwhelming for the client. It's realistic, okay, and it's time bound, right? So we have a deadline for it, and that the deadline is reasonable and realistic, okay? It's something that the client can reasonably attain. All right, so our first treatment goal is Nathan will identify one activity that he enjoys and will participate in 1 day per week. Okay, so we're not asking him to, get out of bed and go for a run every day or something like that. That might be really overwhelming and not attainable. Okay, but you'll notice that it is specific. We have a time and measurable aspect to it, right? So 1 day per week. Okay, so we're not asking him to do this every day. We're starting with 1 day. Okay, so the client strategies, we have create a list of activities that previously brought enjoyment. Okay, so maybe we are having, the client is sharing with us things that he liked to do. I used to like to go hiking, or I used to play on a bowling league, or whatever it is. And then create a list of current interests. And this might be a little bit challenging because, someone who is experiencing depression, they are often not finding joy in things that they used to previously find pleasure in. And so, this might be where your clinical skills need to come in a bit, where you're kind of soliciting some of those interests through maybe storytelling, of past things that he was involved in, and so on. And we'll talk about that in a second under counselor strategies. Research local opportunities for activities related to the client's interests. Okay, so that might be looking at, groups on social media, or, let's say that the client is interested in history, right? And so maybe you look at, Baltimore history discussion group, or look at the county library page and see if they have any talks or groups, reading groups about history or something like that. Okay, and you'll see again that we have that under the counselor strategies. And then for the client to choose at least one activity to try. All right, under the counselor strategies, provide client education on the ways that pleasurable activities facilitate the release of endorphins. So it can be helpful for the client to understand why we are working on the goal that we're working on, right? And so we know that, for someone who is living with depression, and they withdraw from things that bring them enjoyment, it actually changes the way that the brain is functioning. And we know that even if we're not necessarily enjoying the activity while we're doing it, especially not enjoying it in the ways that maybe we did in the past, just by getting out and doing things that we previously found enjoyable, or a new thing that we might find enjoyable, is going to facilitate the feel-good chemicals in the brain. Okay, so think about, like, in your experiences, even with classes or what your employer has asked you to do. Sometimes you might be resistant to doing something, but when you understand the why behind it, it makes it easier to buy in. All right. And then the second counselor strategy, I have encouraged storytelling about past enjoyable experiences and activities. All right. So that's what I was talking about as kind of connecting with, having the client create a list of things that he is interested in. And so if the client is struggling, the client might say, like, I don't know, I just don't really feel motivated to do much of anything. So tell me about something that you used to do, before you and your girlfriend broke up. Like, tell me about things that you used to, or even before you were ever together. What were things that you liked to do when you were single? Okay, tell me a story about the best kickball game you ever played, or things like that. All right, and then assist the client in finding local activity resources and opportunities. So whereas we want the client to have some responsibility in doing that, if we're noticing that might feel a little bit overwhelming to the client, or he doesn't quite know how to get started with that, we might even spend some of our session time, on the computer together, looking up different activities and things like that. And so maybe we help the client do that, and the client leaves with a couple of resources, and then it's on the client to then follow through with actually engaging in the activity. Okay. And I want to mention, like, one of the things that is a best practice is that the client should be involved in coming up with these goals. So this isn't something we want to write up without any buy-in from the client and then just sort of prescribe it to him or her. So imagine if I was actually working with this client, Nathan, this is stuff that we would kind of negotiate in session. And then I would write it up clearly like this for us to go over together. All right. And then lastly, I like to identify available supports. Okay. So, let's say that the client said his friend Matt is someone that he feels that he can talk to about this and that he trusts. Maybe the client has a coworker who is involved in an activity that's interesting to Matt. Or to Nathan, rather. So, if he says, oh, my client or my coworker, Beth, she's a captain of one of the kickball teams. I used to play kickball, so maybe it would be worth just talking to her a bit about that. Maybe I'll get back into that. Okay. All right. Then we want to know, how are we going to measure progress? So how do we know if this goal is being met? Okay. So this one is simple. The client is either engaging in the activity or he's not, right? And so I like to remind clients that even if they're not meeting the goal, but maybe they're making strides toward the goal, that's progress, right? And so maybe he's found a list of activities, but he hasn't, after a couple of weeks, he still hasn't engaged in one. Okay. We don't need to feel badly about that. We don't need to make the client feel badly about that. That gives us data, right? So then we can kind of unpack with the client. So, I see that you have found a list of activities, which is awesome. And you're making some really great strides towards, supporting your wellness. But there seems to be a disconnect between identifying what you want to do and doing it. So let's explore that, right? And so I have a target date here. I put this one as, November 15th, which is, I don't know, about a month away, 3-4 weeks away. And in part because, we don't want it to be so far off in the distance, that the client can easily just keep putting it off, because we want to be able to create some change that's going to bring the client relief. But we also don't want it to be so close that the client is going to feel rushed or overwhelmed, or feel like he's been set up to fail if he doesn't accomplish it within a week, for example. And then I always have follow-ups. So, once we hit that target date of November 15th, I'll either say, okay, this has been achieved, or that we need to revise the goal. Or maybe there's some other objectives that we need strategies that we need to include in here. But I'll jot some notes down about how it's going. Okay. And then, sometimes we might only have one goal that we're working on at a time, but we might come up with multiple goals. Okay, so I generally start clients off with 2 goals, and that we collaborate on and create together, and we talk about the strategies and the supports. And I sign off on it and the client signs off on it. And we talk about how even though we're signing off on it, it doesn't mean that it's set in stone. But we're signing off because it's showing that we are both committed to this collaborative goal setting, and that we're both committed to creating change that's going to be helpful for the client. All right. So I hope that's helpful for you. This is something that we get better at with time. And you'll start to develop your bag of tricks and realize, okay, when I have this kind of client, these are things that I tend to find that my clients find helpful. And so you might take a goal and tweak it a little bit for different clients to meet their individual needs. So happy treatment planning, happy treatment goal writing. And remember that this is something that practice makes, I don't know if perfect is the right word, but practice makes progress.